Secretary Cohen, I know that your life must be just very hectic right now, so we appreciate you taking time to speak to our audience. COVID-19 or coronavirus is the main topic of conversation wherever you go today. It's on everybody's lips. There are some who are saying that the media is overhyping this and sensationalizing the coverage of this. How much of the hype is legitimate and how much of it is real?
So what I would say, I've been getting that question a lot. Why should we care? Should we pay attention to this? And what I would say, particularly in the last couple of days that has been worrying me is as I watch the disease progression across the world, we sort of saw what happened in China, but now seeing how quickly things progressed in Italy, for example. They went from 600 cases to locking down their entire country in 11 days.
Wow.
And that signals to me that they are overwhelming their medical resources at this moment, not knowing the deep specifics. We're not there, but some of the reports I'm reading from there. So that gives me pause to
Here
say—
in America, we went from 300 cases to 1,000
That's right.
in a period of a couple of days.
Mm-hmm.
We're told that this coronavirus is actually a strain of the flu. How do you differentiate coronavirus and the flu?
Yes. So it is not a strain of flu.
Okay.
It is an entirely different family of viruses. Coronaviruses, there are actually multiple versions of coronaviruses. Some of them have been circulating for many years, and others of coronaviruses we've heard about before. SARS, MERS, those are coronaviruses as well. This is another new coronavirus the human population has not seen before. So that means there is no immunity to this new coronavirus, which is now called COVID-19. And that is the reason for concern here. One is because we're seeing how quickly it is spreading. That is pretty contagious. And again, no one has immunity. And the other thing that gives me pause is unlike the flu, where we have both the flu vaccine as well as flu medicines like Tamiflu that we can give folks if they become sick. With this new coronavirus, we have neither of those. We don't have any medicine and we don't have vaccines. So the things that we can offer folks if they do get really ill are really supportive measures. And so that's why preventing this and slowing the spread of this is top of mind.
And they say that anybody who contracts this, is likely to infect two other people. Is that why you're so worried about this?
That's the contagious part of this. So that is what we're talking about. So what we're seeing is it's not as contagious as measles, which is highly, highly contagious, but it is seemed to be more contagious than flu. And so that, again, the level of contagiousness, the speed at which we're seeing more and more people get this, the fact we don't have medicines and vaccines is making me say to folks, we got to take this seriously. This is not a media hype. This is for real.
Governor Cooper called a state of emergency on Tuesday. Now, typically when a state of emergency is called, there's a storm that's getting ready to hit us directly,
right.
Or we're trying to recover from a storm that has happened. With only 7 cases known at the time, why did the governor declare a state of emergency?
Yeah, so I'm very thankful for the governor taking a very aggressive posture here to protect North Carolina and to make sure that we are as prepared as we need to be. And this is about preparation. We want to declare that early so that it allows us to mobilize the resources we need to now while we still have time to prevent some of the spread.
He said it would remove some barriers for people getting treatment. Explain that.
Yes. So it gives us some flexibility in a variety of ways. So it gives our state health director, who works for me, Dr. Betsy Tilson, some authorities to make recommendations like we did yesterday about moving to telework, about recommendations related to large mass gatherings. We want those flexibilities to be able to help people understand how to manage risk and to slow the spread of infection. So yesterday we did, along with doing the executive order, we did issue new guidance that we want folks to be following. And we're at the point of recommend, but the executive order does give us the ability to say you must, and potentially we may get there. We're not there yet. We're still at recommend, but we may get to you must. I think the other point, to say about the executive order is it gave us flexibility also to mobilize people resources, and that's what we need to do. It helps us in hiring the people we need, getting the lab equipment that we need, tapping into our emergency fund that we have in North Carolina. And it prevents some of the price gouging that we're seeing where people are selling Purell for $300, a little thing, right? None of that are things that are acceptable. So we needed all those to be in place. Is it true
we don't really know how many cases there are in North Carolina because we haven't had the test kits that were available? And if so, how is that coming along now?
Yeah, let's get into testing. So we do have 7 positive cases as I sit here today. I bet by the time this is on air, that will likely be different. I do expect to see more positive cases. So the issue with testing, and I want to be clear with language here because test kits have gotten us all confused because there are different parts of testing. There's the part of testing that's actually taking the sample from the patient. You swab their nose, you swab their throat. We have plenty of that. We can swab plenty of people. The issue is when you get to our lab and we want to run that swab, that sample on our machine, we need a particular supply of what's called extraction kits. We need some chemicals, reagents that help us break down that sample and get the DNA out and allow us to know whether or not you have COVID-19. And it's extraction kits that is our rate limiting step. And so I think there was a bit of talking past each other because they were saying kits and I think we were saying extraction kits, and we need to get to a way to be really specific. What we need is extraction kits. And I should say we at the state lab are not alone. This is happening to all folks around the country. They're having daily calls. We are not unique here. I think we are the loudest in trying to raise the alarms about this, but it's not unique. So we've been doing a number of things to try to troubleshoot the problem. One is obviously raise the issue directly with the federal government. The governor spoken directly to Vice President Mike Pence, again, to make sure that we're all speaking the same words here. This isn't about blame, but let's just get to the root of the issue and solve the problem. Right. So that's one issue. And again, it's a back order issue. The supplies are just literally on back order.
We were told that Burlington's LabCorp is working round the clock.
So that is right. So that is the way in which we're trying to troubleshoot. And I think that puts North Carolina in a good position because, as you know, LabCorp is right here in Burlington. I just spoke with the LabCorp CEO. Again, we've been on calls multiple times, and they are going to take some of our be able to take on some of our testing that we would normally do in the state lab and are going to help us. They also are using a different methodology than our lab is using that isn't as tied to the same supply chain issue. And so right now our teams are learning from LabCorp, testing at LabCorp, and hopefully we will be able to use their methodology at our state lab soon to try to circumvent these supply issues that everyone is seeing. So LabCorp's been a very good partner. We will rely on our private partners through this, but testing has been more limited than I would like to see.
I've read that the coronavirus, you may be in contact with someone with it, and it may be days before the symptoms actually materialize. So what should I be looking for?
Great question. One, I would say you're still learning about this virus, and everyone, it seems, is a little bit different. But on average, the kinds of symptoms that we're seeing for coronavirus are mainly 2 buckets. One is fever. So we're really not, fever is a really big indication. And then what's called a lower respiratory illness, so in your chest. So issues with cough, and difficulty breathing.
And it's a dry cough.
It's a dry cough. So it's a cough, and it's an inflammation in the lower part of your lungs. So people are like, oh, I have a little sniffle. I'm not that worried about that. Though again, we're learning, and everyone presents a little different. But what the criteria we are using are fever and lower respiratory symptoms and then people who are flu negative. It is still more likely, if you're here in North Carolina, that you're going to get the flu than COVID-19.
Yeah, we've had 127 deaths so far.
That's right. We haven't talked about that much because we kind of are numb to it.
Is it too late to be vaccinated?
No, please get your flu shot. It's not too late. Now, we are past the peak of flu season, which is good, but you can still get your flu shot. I was just talking to my brother last night who needs to get his flu shot, and he's going today because it is not too late. And so we want to make sure folks can get their flu shot. But fever and that cough are the things that we are looking for. And and getting tested for flu first. If the flu is negative, then we want to make sure you're getting tested for COVID-19.
Interesting. So if I start presenting, as you say in the doctor's parlance, if I start presenting symptoms of fever and a dry cough, what should I do?
You should call your doctor. So before going into some place, we want to see if there is an ability for someone to potentially even come to your home and test you at home. So with some of these early cases, we're able to do that. Now that we're not going to be able to do that for everyone for a large number of people. But I would call your doctor first, or you call your local public health department, your county.
So don't show up at the emergency room.
So we want to keep people away. We don't want all of the germs to be together. So what I would say is, if you are having the symptoms, most folks are going to be able to take care of this at home. There's no medicines and there's no vaccine, remember. So the best we can do is just let you know that you have it, support you at home, hopefully when you can stay home, and your body will self-recover. Most people will, that is how things will go. But we want folks to know that they're tested so they know to isolate at home.
Is there such a thing as mandatory quarantining a person? I mean, if I've got coronavirus, certainly I shouldn't be out in the public.
Oh, yes. And in fact, our local health departments have exercised their authority to do what's called isolation, not quarantine. So once you have the infection and you are sick, it's called isolation. Quarantine is when we're asking folks who are well to stay in their home or stay isolated. But yes, we have those authorities and we have exexercised those.
I read somewhere from a Chinese epidemiologist who by himself was being isolated, that it helps to drink water.
It's never bad to drink water. Yes. So anytime you're having an illness that you want to stay hydrated, because again, if you have a fever, which you likely would if you are sick with this, fever causes you to have losing water. So drinking water is always a good idea.
Why is it that they're saying that people over 60 are more susceptible to this than perhaps even younger children?
We don't know why the virus is more severe only in the older population. We are looking at data that we are getting from China, from Italy, and what we're seeing first cases around the world. And it seems that those that are above 60, we're saying the cut point's probably around 65. It's not that folks are more susceptible. It's just that if they get sick, the symptoms are worse.
And if they've had respiratory problems, there's
exactly.
pre-existing conditions. What are the pre-existing conditions that
might play into this? So obviously lung disease is the most concerning to me because this is a lung problem, right? It's an infection that impacts your lungs. And so people with underlying lung disease are probably most concerned to me, as well as people with weakened immune systems. But the CDC put out guidance to make that even broader. So they are saying people with heart disease, lung disease, diabetes, and others, and as well as a weakened immune system. So they're trying to bucket it. All folks with chronic diseases have more risk. Again, these are levels of risk. They have more risk of having severe reaction to the
So
virus.
I hear you saying not necessarily need to go to a hospital.
Not necessarily.
Is the medical community in North Carolina properly prepared for this?
I think those are the questions we are making sure that we're asking right now to be prepared. And so, like I said, the vast majority of folks will just be home. Now, they won't feel well, and I feel badly that they'll be home. But as long as they're not having difficulty breathing, they can be at home and recover at home. The question is, when they step up to having difficulty breathing, are we able to make sure that we can handle that capacity? And that is exactly the work that we need to do, and why the governor declared the state of emergency yesterday, so we can mobilize the resources and prepare now. I hope we don't ever get to that point where we're nearing a capacity situation. But looking at other places, I want to get ourselves prepared. So we have been in close contact with the hospitals. I personally have been talking to a lot of the CEOs, particularly of our large systems. All of our large systems have strike teams for COVID-19 and are thinking about capacity issues. We're working on flexibilities to allow them to increase bed capacity. We're making sure we have the oxygen supplies that we need. But that's the next area of concern if we see a great increase in the number of cases. So we want to be prepared here in North Carolina.
Coronavirus is already disrupting life in North Carolina. And I think I hear you saying between the lines that it's likely to be even more of a disruption. Uh, do you have the authority? Does the state have the authority, for instance, to call off the ACC tournament if it warrants it?
So, I mean, the short answer is yes, we believe we have the authority to do that. And we need to take this day by day. And what I would say is this is a day by day kind of activity, and we need folks to make sure they're getting good, accurate information, and new guidelines are going to come out potentially every day. Right now, we're at a place where we're just encouraging high risk folks to stay away from large gatherings like the ACC tournament. But we've been in contact with the commissioner. We've been in contact with folks who run a lot of those large events. And right now, we aren't recommending needing to cancel those. However, to your point, reading between the lines is that those things have to be on the table, because if we need to protect public health, we need to take those
And we've
measures.
seen some schools that are already, a couple of private schools in North Carolina have suspended classes because a parent of a student or someone close to the school, and Duke University has announced they're suspending in-class instruction.
Yeah.
Were you a little surprised by that?
So what I would say, we yesterday related, when we put out our guidance, we specifically said we are not recommending preemptive school closure, meaning before, while we're at the beginning of this, there is some data in a flu epidemic that closing schools could help stem the spread. Given that the coronavirus or COVID-19 is different and doesn't impact kids in the same way, we're not feeling like we see the data in getting to preemptive school closure. Now, there may be isolated reasons to close a school here and there if there is an exposure and they want to do a deep clean. Those are all things that we want schools to use good judgment and take the precautions that they need. But we're not encouraging mass school closures. And in fact, we want to make sure, we are worried if we close schools, where do kids go? They go home and grandma's watching them and grandma's at higher risk. And so we want to be smart here. And we also know that closing schools, that's a major disruption from an economic perspective, as well as the workers who need to be on the front line responding to this crisis.
Well, you and Dr. Betsy Tilson and Chris Mackey and your team put out a great press release a week or so ago of things that you can do to try to stem or avoid this coronavirus. But it included a lot of common sense things like washing your hands frequently. And avoiding contact with your face and with surfaces a lot. Any other advice that you can think of that helps me try to avoid this?
Yes. So, well, we are here in the Triangle area, Tom, and so I would recommend, to the extent possible, that folks are teleworking in the Triangle area. Again, just to cut down on the amount of interactions and opportunities for this virus to spread for folks. So we are recommending that folks in the Triangle area do as much teleworking as possible. You will see us lead by example at the state. My department is asking our employees that we can have telework to do that. Obviously, we're also ramping up and doing the preparation work, so not everyone is going to be able to do that. And I recognize there are folks who work in restaurants and our teachers. They're not able to telework. So this is not for everybody, but as a first step, I'd encourage folks to do that.
Just exactly what steps can the state take? I'm very impressed with the preparation that you've already, but you mentioned, for instance, having the authority to call off large events or something like that. What else could the state to do so far as emergency prep is concerned?
Yes. So, I mean, we're seeing a lot of event organizers cancel events proactively, which we encourage. We are glad to see those happen. If we feel like we're seeing an acceleration of cases and concern, we will exercise our authority to make additional recommendations. We're watching. What I would say is we're watching there are countries and states who are a few days, a week ahead of us, if you will, in terms of severity of what's going on. So I am watching very closely what's happening in Washington State, what's happening in New York, what's happening in California. What kind of authorities are they exercising? For example, yesterday, New York locked down a 1 mile area in the New Rochelle area. So we're trying to understand authorities there. operationally, what did they do? Because is that something that we would want to or need to employ at some point
And how does
here?
that work?
Exactly. I'm learning about that today. Right. So those are the kinds of things. And so I think there are some that we are aware of. There's learnings that we're going to be sharing across the country.
You know, it's something that we all want to make sure we know as much about as we possibly can. You touched on something I think is very important. We need to be informed, but we don't need to panic. So if I want to know the latest of what's going on, certainly I trust you and Dr. Tilson and the governor in this. North Carolina is never better than in emergency situations. So where do I go to keep up with the latest information on this?
Thank you for that. And so please check back often. It's on the North Carolina Department of Health and Human Services website. So you can always Google North Carolina Health and Human Services and coronavirus, and it'll take you to the page. But it's ncdhhs.gov/coronavirus. And there's lots of information that is being updated
Constantly.
hourly, yes.
Yeah.
So
Right.
check back.
Any last words that you'd like to share with the people of North Carolina? Any message that we need to know?
I think that this is going to be a rapidly evolving situation. And so I'd say stay tuned for more information. I'd also say we need to approach this with as much compassion that we can bring to this as possible.
And patience.
And patience. Thank you, Tom. This is going to be a challenge for us. I hope that we are going to do enough early on so that we're going to get ahead of these things. I think we are prepared. We do have some weaknesses around testing that we are rapidly working to try to solve, but altogether, that I feel like, as you mentioned, North Carolina, like we've been through a lot. And we've gotten really good at preparing and being ready to respond to these things. So I want folks to know that we are ready and are mobilizing to respond to this. Stay tuned for accurate information and treat each other with compassion and patience as we work through this.
And one of the big questions in any event like this is who do you trust? And I've worked with you and your department long enough to know that I can trust the information that comes out of DHHS. And on behalf of the state of North Carolina, I personally just want to thank you for what you're doing.
Well, thank you, and thank you for getting good information out there for us. Appreciate the partnership.